All right, we're going to go ahead and get started. So I really want to welcome everyone this afternoon. My name is Dan Ockey. I'm the superintendent here at the Claremont County Board of PD. Been on the job for about 7 months now or so. I've been with the agency for 6 years. Prior to that, I worked in Hamilton County for a number of years. Really excited about the job. Love the variety. Love the challenges. Love the things. And most importantly, the people and the families that I get to interact with. So we're just going to take I'm going to take a few minutes this afternoon. Just wanted to share with you all just some things that are happening from a 35,000 foot level kind of thing on the federal side, state side, and then at the local level. The reason I decided to do this, our board, what was that? Did that work? Our board takes the month of July, typically takes the month of July just to regroup, our 7-member board. And so, and when they come back from that break, that's really when we start to hit the planning season. So we really start to hit planning for 2016, heading into August, September, October. And they're looking at a lot of different things. So they're looking at, things that are happening that I'm going to be touching on this afternoon. Some of our, obviously financial outlooks, things of that sort. So what I thought would be good is for me to share with you all some of the things that we're seeing, some of the things that are happening, answer any questions that you might have, and really just be, and then at the end, I have an idea that I want to share with you all as well, related to some things that we're planning heading into August, where we can get even more input from you all if that would be of interest to you. So I'm going to try, some of this will be very kind of, some of it's going to be pretty touching on some things. I can't get it, for the sake of time, I won't be able to get into a lot of meat and potatoes, but it will be touching on a lot of things. I'm going to ask if you have questions. I think for the sake of time, because I really would like for us to maybe, because I know a lot of people need to get back home to meet their loved one, maybe off the bus, things of that sort. So we want to keep it, pretty efficient. For the sake of time, if you could hold your question maybe till the end, I am going to have a time at the end for questions. So if you can do that for me, that'd be helpful. We'll get through these slides, and hopefully they'll generate some questions that you have, and you've maybe brought some questions to touch on. I'll do my best to answer every one of them. I may not be personally able to answer every one, but I promise we'll get an answer for you. So we're ready, I think. So let's jump into it here.
How long do you expect it to last?
The question is how long do I expect it to last? I'm hoping we should be very latest by 3 o'clock, but that would be at the very latest. That's the very latest. So we're gonna move right through it. Okay. All right. So let's jump into it. I have, and I'm going to be touching on some subjects that maybe some of you are very familiar with, and maybe some of you, it's maybe the first time you hear it. I'm going to be saying things like waivers, Medicaid, individual budgets, just things that are terms that you're maybe familiar with or maybe not. But I wanted to certainly start with some issues that are driving change in Ohio, and the system for Ohio's PD system. I put new CMS rule. Actually, it's not new. The rule for CMS, which is the Centers for Medicaid and Medicare, which is kind of the federal. This is my kind of 35,000 foot kind of discussion. So this is at the federal level. Okay, we provide services, and we can bill Medicaid for those services. And the Centers for Medicare and Medicaid have actually changed some rules related to what they're going to be willing to pay for services going forward. And as it mentions up here, the funds that, I'm just going to read the first one, the funds can no longer be used to pay for waiver services that are offered in or adjacent to institutions or settings that have the effect of isolating people. So what does that mean? What the Medicaid waiver program will, going forward, will not be willing to pay for anymore are settings in which maybe individuals live in large congregate settings. And the other one that's kind of been hanging out there on the day services side are large sheltered programs, so sheltered employment programs, like your workshops, things of that sort. Okay? I forgot to mention, on the table, if you haven't already done so, there's a number of different documents and things of that sort that touch on a lot of this in a lot more detail. So if you are interested in reading some more about that, you can grab those on your way back out, okay? So, so that's the first thing. And what happened is Ohio has to respond to, they have to send a plan to Medicare and Medicaid to say, what are we going to do to kind of adjust our programs to make this happen? So Ohio has done that. Okay, so Ohio has sent in their plan to say, this is our intent on how we're going to try and adjust to meet these requirements. The one thing that has been out there that I want to make sure, the time frames for this are anywhere from an understanding of about 5 years from now, 4 or 5 years from now, till 10 years from now. So Ohio, on the day services side, has asked for 10 years to be able to make some of these adjustments. So what does this mean? What it means is that when we start to look at the rules and how we're going to adjust for services, we're going to need to look at different environments and see, does it meet the new requirement or does it not? And if it doesn't, then we're going to have to put in some plans to figure out how to make that happen. And there will be some opportunities to be able to work with different providers, work with different agencies to help them make that transition. The second thing I wanted to share with you is under this conflict of interest provision that has come out from the Centers for Medicare and Medicaid. This is guidance from CMS that says the same organization can provide both case management and services because it isn't in the best interest of the individuals being served. So what does that mean? So for county boards in Ohio, county boards for a number of years have provided both what are called the case management services. So those are kind of your SSAs, which are a number of those guys who are in the room with us this afternoon, and also have provided day services. So like your typical workshops, things of that sort. What CMS is saying on Medicaid, for Medicaid services, so these are for Medicaid services, okay, that we offer and we provide, that no longer, going forward, will be able to be provided by the same entity. So, in order to, you can either be the provider of the service or the case manager of the service, but you can no longer be both, okay? So, what does that mean? So for purposes of, for a lot of the county boards in Ohio, they provide both. So we provide both the case management services and the day services, typically day services, Medicaid day services, in both. What Medicaid is saying is, going forward, we're not going to be willing to, you have to choose one or the other. So that was a pretty big deal because in Ohio, especially in some of your bigger counties like the Hamiltons, Franklins, Cuyahogas, Cleveland, Columbus, Cincinnati, they're serving hundreds and hundreds of people in their day services programs, and they're providing the case management services. So when you look at that, that's a very big transition that would have to happen for a period of time, and that's impacting a lot of people. That impacts people here in Claremont as well, just not to the same degree. So when Ohio saw and heard of this provision, the request was, okay, well, it's going to take us some time to do this. If we have to do it, it's going to take us, we just can't flip the switch and make that happen for hundreds and hundreds of people, if not thousands of people. We'll need time, and so Ohio asked for 10 years for that transition. And as of about 3 weeks ago, we heard from CMS that that 10-year span was actually granted. And so that's pretty big news for the sake that what that means is there's actually about 9 years now that county boards that provide the case management and also provide the Medicaid services will have to make some transitions over that span of time, over that 9-year span of time. When I get into it, that doesn't impact us as dramatically here in Claremont County, only for the sake, and I'll get into some reasons why, based on some decisions that we had to make from a financial perspective in 13 and 14 related to some Medicaid services that we provide. So I'll get into that a little bit more in depth a little later. So the last thing I wanted, a couple other things I just wanted to share on the kind of the high level. Disability Rights Ohio, which is kind of the legal oversight agency that makes sure in terms of that people with disabilities and people in need are getting what they should. That believe that Ohio is violating the Americans with Disabilities Act and the Olmstead decision because the systems favor segregation and institutional placement. So what Disability Rights Ohio has looked at is that they feel there are too many individuals with disabilities living in what are considered segregated and institutional settings. And so they have been working with the state of Ohio for a while now to say we really need to make some changes here to have some impact where people have more choice and are living in less congregate, segregated settings but more within their communities. And so that's the request there.
Has that group suggested any alternatives?
The question is, has that group suggested any alternatives? Well, and I'll get into kind of how Ohio responded. So that might answer your question as we kind of go from there. So the last thing, which I think also is a big topic, which is the question about the independent provider issue. That came about kind of as a last, kind of late in the game related with the budget discussions were going on at the state level, where there was a big push to say that no longer Ohio could use independent providers for the services delivered to individuals, not only with developmental disabilities, but across, whether you needed them for medical reasons, things of that sort. Because we have a number of different options. Individuals can choose to have an agency provide their services. They can also choose to, if an independent provider, someone that just looks to kind of almost start their own business and become their own independent provider, individuals can choose to have them provide their services. There was kind of a late in the game push to try and, in the budget, to remove that option for independent providers for individuals. And what I can tell you is there's such a backlash related to that in terms of the individuals served and their families, that through advocacy and through, actually a couple of folks in the room that actually went to speak in front of some of the different Senate committees, finance committees, things of that sort, that actually got removed out of the budget this go around. So that is still, we're still able to use independent providers at this point. There's been no change related to that. But that is something we're going to keep a very close eye on because I'm not sure that subject is finished yet. So we'll keep an eye on that. Okay? So those are some of the things right now that are kind of driving some change. Here's the headline from Governor Kasich's the budget that just wrapped up everything. I learned more about that process than I had ever really known related to what it meant in terms of the process at the state level. It goes through a lot of different processes, but it just wrapped up as of July 1st. And in it, Governor Kasich's budget invested, this is kind of a headline here, $286 million over the next 2 years to increase opportunities for Ohioans with disabilities to live and work in the community. So that's a pretty big number, and it's probably like, oh wow, when you look at that, you think, okay, well how does that impact us here in Claremont County? Well, what that means is it goes back to a little bit of what I mentioned in terms of the Disability Rights Ohio discussion. This is the state's reaction to making sure that it's addressing the issues that were brought forth by Disability Rights Ohio. So what's happening is, over the next 2 years, about 3,000 new state-funded home and community-based waiver services will increase support to people on the waiting list and those who choose to leave intermediate care facilities and developmental centers. Okay? So what does that mean for people in Claremont County? I don't know the actual, I don't have what that exactly means for us here yet. I do think we'll be able to have, we'll receive a few of those waivers to be able to have people that are currently on our waiting list to be able to get a new waiver. I don't think it's going to be a huge number, but I think it's something that we'll certainly see. Where it has a bigger impact is everybody familiar with SODC, the developmental center that's down in Batavia? So there's a big state-operated facility that's near the airport. They serve individuals at that facility. It's a residential facility. And what that means is that in an effort to help individuals that would like to move from that facility, these new waivers are going to be available for those individuals that would like to choose to use one of those waivers to move from that, I'm using this as an example, from that facility into the community. And so what ultimately it is doing is addressing that concern that was brought forth by Disability Rights Ohio, which says there are too many individuals in Ohio living in facilities like the developmental center, and we would like to have individuals have more opportunity to live in their communities. And so this is a response to that. So that's over the next 2 years that we'll see how that impacts some folks that live in those facilities and what that means for some of the individuals here in Claremont County. A couple other things out of the budget, also some individuals who, some of you may in the room may be receiving what's called a TDD waiver or a transitions waiver. Those will be converted to individual options waivers. So those are waivers, your more traditional IO waiver. And that's going to be over a 2-year process as well. So we'll see that as far as improving access to providers and increasing access to services such as day services. For those individuals who are on TDD waivers, access to day services was very limited. So this is kind of it's a good news thing for those individuals to be able to access that. And the last thing it does in terms of the budget, it includes nearly $3 million in new funding for each of the next 2 fiscal years to create new service models that promote community employment and integrated day services. I'm sure you've probably heard the terms employment first. The state is very invested in assisting individuals with developmental disabilities to seek employment first before any type of traditional day service. So these funds are going to be used to be able to put forth the funds to be able to start new programs or get creative with new ideas related to programs to help more and more people obtain jobs in the community, and to also look at how we do more and more integrated day services to the people that we're serving. So those were kind of the big highlights out of the budget. $3 million doesn't sound like a whole lot for the whole state. Well, what's really designed, that money is going to be designed to fund things like creative projects that could be examples then for others to follow. So when you think about it, it almost could be like a grant opportunity where people could apply to say, we have this really great idea for serving individuals in this type of setting, or in this type of, to create new jobs in the community. So what the people could do is then apply for that, be the example, and then others could follow. So that's kind of the concept of it. This is a slide that actually is taken out of the life map books that you have, that you were able to pick up. I encourage you, if you didn't pick one of those up, I really would encourage you, if you have a loved one or if you are affiliated in any way, it's a really good tool. I just wanted to share this with you because what this does is kind of explain a little bit about what we do. I mean, not only here in Claremont County, but DD services in general. We start, I presented this at the commissioners meeting a couple weeks ago, last week, a couple weeks ago, because I think it's important for everyone to understand DD services in Claremont County. If you've worked in this agency for a number of years, you may have met someone who was or received services as an infant, and they went all along this road to the point that they were, or at least into adult world kind of thing. Where I look at Kimberly because I think she's mentioned a couple times. She's our EI director, and she's like, oh yeah, I remember him when I, saw him down the hallway here, and now he's, taller than me kind of thing. So, so it's something that's very important to recognize that we provide services across the lifespan, either directly or we're touching, individuals at some point along this road. Birth to 5, obviously, that's somewhere in that early intervention area. What we're trying to do there, obviously, is work very closely with those families and children so that we can provide those supports. And hopefully, it's something that, if with the right supports, we may not need to do a whole lot more intervention for them as they go through their life. That's our whole goal there. But then we go through school age. This building that you're sitting in used to be only a school. So I'm looking at Wanda because I'm sure she has some memory of that. So there used to be probably 300 students in this building at one point. And over the years, what's happened is our school districts, our local school districts are supporting more and more kids in their local districts. But we still provide school-age services here in this building for about 50 students. And those districts are actually paying for that service for kids that really have significant needs, either medically, behaviorally, things of that sort. So we're still doing that here in Claremont County. Transition, we're putting a lot of resources towards that more and more. We have our Bridges to Transition program where we're serving 80 kids or so in the district, or in the county, where we actually are working with kids aged 14 to 22 to actually support them to really learn and understand what work is and to build those work skills through different school training and actual opportunities where they're getting out and actually able to experience work at a young age. And what we're finding is that is having a big impact for really students and families saying, you know what, my son or daughter really can work. They can do this, and it's really having a great impact for those kids finding jobs as they graduate from school. So we're very excited about that. And then as we head into the adult world type thing, we are certainly still providing day services and work services, community employment services, small group opportunities for individuals to go out and work in some businesses around the community. And it goes right on through as they age. So I just wanted to show that slide, and that is in your handout there, your lifetime handout. Take a look at that. Just to emphasize again, what do we do? I mentioned school age services, our adult services, early intervention. We have a number of SSAs, community support staff here that provide case management services. We also do investigations. So in any situation where there's an individual with a developmental disability, where maybe in the bad instance that maybe there's abuse, neglect, things of that sort, we have the responsibility to investigate that and work with either that provider or family member to put plans in place to correct that. If it's truly a serious matter, we refer that on to the police, but it's something that we certainly start with our investigations folks. And then behavior support, we provide behavior support services in programs and then also in homes and around the community. So that's something, and these are a lot of things that we're going to continue to do. They're really, we're not looking at anticipated any real changes with any of these as we head into the next year. So I wanted to get into a little bit of just kind of sharing with you. I think it's important for you to be aware of kind of some of the financial outlook pictures, things of that sort. Dave Sinder, who's our business operations director, is in the back there. He puts this together for us. This is something the board looks at quite closely, and this is something that we have to keep a very close eye on. So this is a very condensed version of this, so it certainly is not encompassing all the things that we have in terms of our line items, but it kind of takes into account some of our revenue, our expenses, and gives the board a picture of kind of where things are headed. So if you can see here, I want to point out a couple numbers towards the end. As we get towards projected into the end of 2018, beginning of 2019, you can see that we start to operate, and we're operating in deficit funding. So this is something that we cannot let happen. So it just is simply a situation that we can't get here. So this is why we're looking very closely, and when we do that, we have to make decisions related to both our revenues and our expenditures. Just like any business, we have to look at it from the standpoint of if we need more revenue, well, how can we make that happen? And if we need to make decisions related to expenditures, how can we make that happen? And those are the things that we've been working on diligently for, well, we do it all the time, but certainly as we see these outlooks, we have to really pay close attention to where we're headed with some things. So,
One question.
yes.
Why all of a sudden in 2014, that day rate goes from 600 down to 165?
Okay, so the question is, why do we see this day array? So these are under, you see this number 604,428, and we go to a projected, an actual is 165,000. This is under the revenue category, okay? And I'll get into kind of what this involves. And this goes up to the next couple slides down the pipeline into some actions that we took in 2013 and 2014. We made a decision in 2013 based on some of the forecasts to look at our adult services program and to restructure that. And so in our adult services program, we were serving individuals that come to us with a funding source called the waiver, okay? So they were coming to our program with the waiver. And we also have some individuals that attend our day services program that we just fund locally. So we have our local taxes that we support individuals that come to our program there. And then we also have a contract with the developmental center to provide some day services. What we decided in 2013, based on the forecast, was to look at what are some things we can do to offset some of the concerns that we were seeing there. And one of them was to say, okay, for those individuals that attend our day services that use the waiver, they can take that waiver and they can actually purchase that service from a private provider in our community. So they can actually get a service, get a good service in our community, and what it does is it actually then, we can, and it gets a little tricky, we can generate revenue for billing the waiver, but what was happening was that revenue wasn't covering all the costs of running that day service. So we had to say, okay, we can generate the revenue, but we still are putting a lot of money into running this program. What's the best decision? Because then ultimately they can get that service in the community. So what you see here is in 2014, we were still billing the waiver because that was that transition year. So we made the decision late 2013. Individuals had a year to make that transition in 2014 from day services that we were providing to day services in the community, but we were still able to generate that revenue. But as you can see, that dropped off significantly to this number because we're no longer billing the waiver for as many individuals. We still do that for individuals that attend our Enclave program or our small group work programs that we operate with American Micro, just different companies around that we can actually, 4 or 5 individuals go out and work and do that. We can actually bill services for that, so we're still doing that. So that answers your question? Okay. I want to talk a little bit about levies. So it's just important, I think, for everyone to be kind of aware of how it works for us here in Claremont County related to our levies. Because it's a little different from county to county to county. Here in Claremont County, we have 4 continuing levies. So those are levies that are on your property. If you own property here in Claremont County, it gets generated on your tax bill every year. So we have 4 continuing levies, and then 1 levy that is a 5-year operating levy. So as you can see, and this agency was very busy in the late 70s. As you can see here, as you go down, in 1977 there was a levy passed from 0.2 mil. 1970, actually it started with the 1976 levy year, 0.9, 1979, 1980. So those are 4 continuing levies that have been on the books for 35, 36, 37 years, depending on which one it is. And then we have the 5-year operating levy that was originally passed in 2003. The reason I wanted to show this to you, because I want to make sure you kind of understand how this works a little bit. So if I'm feeling kind of like I'm blocking some folks, but if you see the numbers here, what happens over time, this is the voted millage, so we have about 3.25 voted millage. But as you can see, as we go down, over the years, what's happened is as these were voted in way back in the late 1970s, over time they start to lose their value. And what I mean by that is, let's say you had a $100,000 house back in 1979 or 76 or whatever, which one you ever want to pick. What happens is your property values over those times hopefully have gone up. So what's happening is it's no longer a $100,000 value. Now maybe your house is worth, let's just pick a number, maybe it's worth $150,000. Well, what happens is that as an agency like ours, we're still just collecting on that $100,000 rate. So as your property value is going up, we're still collecting just at the $100,000. So what's happening is that the effectiveness of those levies starts to go down, especially as you get into 30, 35 years later. They just don't have the same effective millage. So what we have to look at is there anything that we can do about that? And so what we're looking at doing is, is ultimately looking at how can maybe we look at generating some more revenue, and this is where we anticipate we'll be doing this hopefully in 2016 as we look at levies down the road, is to be able to replace a couple of these levies so that we can generate some more revenue, so that we can offset some of those numbers that I showed you in the previous slide. So, and that's something that has to go before the voters. That's something that actually has to be voted upon to replace those levies. But ultimately what that does is able to generate more revenue. We actually did that in 2010 with the 0.9 levy there. And then the 5-year operating levy has to go before the voters once every 5 years. So that was 2013, will be 2018. So we're in the process of working on plans related to that for 2016. So I just wanted to share that with you, just kind of hopefully share some information related to that for you. As I mentioned, some things we've taken to address the forecast in 2013, 2014, we restructured the adult services program, which I've already talked about. When we were able to do that, what ultimately that helped us to make some decisions around, and all because we're not serving as many individuals in our programs, is we were able to reduce by 1 building. So we have this property here that you're in right now, and then we have 3 other properties that are in the industrial park near the airport. One of those properties we really no longer, because of our restructuring, we no longer need to keep. So we're actually going to be able to actually sell that property. It has to go through the auction process because it's a public building. It has to go through the auction process. But we're actually going to be working on that here real soon. And then in 2015, our board had to make some very difficult decisions because of that forecast, which is to look at any new services off our waiting list, most specifically around waiver services and individual budget services, to put a freeze on those. And that has had a huge impact for the people that we're serving. I mean, as you can imagine. When our waiting lists grow, then that's certainly something that has an impact for the people in our community and in their homes specifically. So, and that's something we have to look at heading into, our board will have to, as we head into the planning season, what does that mean for next year as we look at our forecasts, and that's what we'll look at some of the things there. The last thing, because this may impact some folks in the room in 2016, we're also making some changes to our individual budget program. Our individual budget program was put in place a number of years ago to offer alternatives for adult services. If maybe an individual didn't want to attend one of our traditional day adult services, they could use the individual budget to actually purchase those services in the community. So we actually had that in place for years and years and years. What's been a little bit, what we looked at in terms of that program was that there are individuals that have the individual budget, but they also maybe have another funding stream, maybe through a waiver, things of that sort that have been in place. Maybe that's been going on for a few years. They've had that opportunity, that option. When we look at our forecasts and trying to serve as many people as we possibly can, based on the numbers that we have, we really felt strongly that we needed to look at our individual budget program heading into next year to say, if you're receiving another funding source and you have an individual budget, then you're going to have to take one or the other, but you can't have both. And so we sent out some letters to those individuals and families to let them know that that's something we're planning for 2016. And what that ultimately we're hoping we can able to do with that is serve more people. And that's the goal. We want to serve as many people as we possibly can with the resources that we have and being good stewards of that. So that's a change that we're heading into 2016. These are just some graphs that I think are good for folks to kind of see intake. We've had, one is requests for and actual made eligible. As you can see, we've had a skyrocketing number of requests for and those made eligible over about a 4 or 5 year span of time. I don't know if I have a great explanation for that other than the fact that maybe just, I think Claremont is it is a fairly growing county. I think we're seeing more physicians that are much more aware of the services that we offer, and they're referring more people to us. Elizabeth's in the back, she can probably answer this question better than me, but we're seeing Elizabeth Moran, who does all of our intake, a lot of it. So I think it's important to recognize that we are seeing immense growth, in terms of just requests and those being eligible for services over the span of time. Behavior support, this is a number that I thought was pretty interesting to share. These are in-home supports, so what we're trying to do in this situation is to actually provide where maybe it's a situation for a family member that they're just maybe really struggling, they just need some help in the home to maybe get through a difficult time. And ultimately, if that can happen, then it's not something that we might need to take more extreme measures, maybe for that individual to have to move or go to a different facility, things of that sort, which ultimately I think is the best all around for the family and for the services. It was pretty stagnant for a while, but then we boosted it up in an effort, it looks like in an effort to try and really address more need. If you saw the bottom line number is our waiting list number. That was really almost non-existent in 09 and 010, and then even that number started to creep up. So what that's saying is there are more, I guess the way I read this graph is there are more and more individuals in need of the service, and we're trying to meet that need, and yet it's even hard to keep up with it. So we're starting, it's just something that we're seeing more and more as something that's coming. Last one, this is a compilation of a lot of different waiting lists, so these numbers can be a little daunting, but what this is showing is the actual supported living waiver services. These are people that are receiving residential services or some type of service either in their home, it may be 24/7, it might be someone that needs something 24/7, or it might just be somebody needs a little bit of drop-in support in their apartment for a couple hours a day to make sure they're doing okay. What this is showing is that we actually have been able to address that waiting list. That number at the line at the bottom is number served, so it has crept up over the years. But what's happening, as you can see, is that the waiting list number is skewed far greater in terms of us being able to meet the needs. So the waiting list numbers continue to grow at a much higher rate than what we're able to do in terms of actually meeting that. And if we were to take this out to 2015, unfortunately we had to freeze those services, so that line kind of stagnates on the bottom, but that we're certainly anticipating that top line to continue to grow. So it's just, I just want to kind of paint these pictures so you have some idea of kind of what we're looking at, what our board looks at, what we look at a regular basis, probably more, it's just something we need to keep very close on. Future considerations, I just lastly, this is kind of my last piece here that we're certainly looking at. These are CDC facts and figures. 1 in 6 children have a mental disability. 1 in 68, these are numbers out of 2014, are being diagnosed with autism. That is a staggering thing that we're just trying to keep our eye on, especially, I would say, as these kids become adults. I don't want to say, we're daunted at the level with children, but we are certainly, I think, not prepared enough for what this means when these kids become adults. And as a system, we have to really address this. This is something that I think we're going to need to work very closely with our providers in our community to really we need to start thinking about this because these individuals with autism, their needs are, they are a lot of sensory need, a lot of different need related to what that means for the services that they would receive, and we need to be prepared for that because that's kind of, with those numbers, it's kind of a tidal wave that I don't think we're quite prepared for yet. We need to keep an eye on. The numbers of individuals we are serving who require emergency stabilization is now about 20 a year. What that means is that these are individuals that are truly in crisis. It is a health and safety situation, it is a crisis situation that ultimately is not safe for them to live where they're currently living. Maybe that's with their family, maybe that's in another residential facility. But what that means is we have to look at, okay, we're going to have to find a place where they can get some stabilization in order to hopefully move back to those locations. But that can be a very expensive service because we're providing that for about 20 individuals, and that can add up. But it's very important because that's what we're here for, but we're also recognizing that we need to keep a close eye on that. The number of individuals living in the care of a loved one who is aging, that's real. It's real in our community. It's real in every community. And that's something that we need to keep a very close eye on because that wave could be coming as well. And we need, as a system, are we prepared for that? Those are things we have to be thinking about. We have to be prepared for. School to adult transition, that's a lot different than it was 15, 20 years ago. I look around the room and there's a lot of people in this room that it used to be, you went from school, you went to the workshop, and that's what you did. And that's what was written to IEPs, and that's the way it was, it just was transition. That's really not the system that we're going to be seeing going forward. And we need to make sure as a system we're prepared for that. Whether that's being prepared for doing much more of our things like our Bridges program, doing a lot more community employment, but also working with other providers to be prepared for that as well as we head down the pipe. And lastly, I put on provider recruitment and planning. I think it's fair to say, and I don't want, for those that work for the board in this room, I don't want it to be, but I think it's fair to say that the board of DD will be much less. We will be doing fewer and fewer direct services as we head 5-10 years down the road, which means it's going to be a lot more important that we are working with our providers, working very closely with planning for the recruiting, planning, working with those providers to say, okay, well, what's the future? What do you see as services that you can provide? And that we're working very closely together because it's going to be, we're going to be walking hand in hand down that road to make sure there are services there for the people that need them as we head down the pike. So that's going to be a big thing, I think, for future consideration that we're looking at from the board perspective. So I guess that wasn't too bad. About 45 minutes or so. I failed to mention. So you guys, when you came in, you probably saw to the left, or as you came in at the tables here, probably wondering kind of what all those things are over there. In August, this is what I mentioned earlier, we'll be holding some focus groups at each of our local libraries with individuals that we serve, with family members, to really ask these questions. What is Claremont DD doing well? What can we be doing better? And when looking to the future, what should be a focus of Claremont DD? As I mentioned, as our board and as an agency, we head into that planning season, getting ready for 2016. I think it's important to hear from those that actually receive those services and are part of that on a day-to-day basis to really give us some input. And so what we're hoping is that if you have an interest in providing that, we would love to hear from you. We try again we're holding these in the local libraries and those meeting rooms in our libraries that are around the community. So if you see over there, if there is, we try to hit obviously every community that's close to your home maybe. If you would be interested in helping us with that, there are sign-up sheets over there. The times are there, so we're trying to hold them at different various times that might work into your schedule. We would love for you to be a participant in that. So if you live in Felicity and you would like to come to the Felicity branch on that particular date, please sign up and we'll make sure that we get that information out to you so we know we can confirm that with you and make sure we're ready to go. Two last things. Levy help, certainly we are very much anticipating that we will be working on a levy campaign in 2016, whether that be for the primary election in March or the November election. And we are seeking any help that you would be interested in providing. There's a sign-up sheet over there for that as well, if that's something you would be interested in helping us with. We are always looking for help, be it from the biggest to the smallest of things, putting out signs or helping with ideas related to different fundraisers. Or the biggest thing for me, honestly, is I can go talk to every community group out there kind of thing, and I do a lot of that already, which is a good thing. I enjoy doing it, but I think it's most impactful when those people that are hearing that message are hearing it from the people that are actually living it every day. I live it through a work perspective. A lot of people in this room live it on a real life, day-to-day, minute-by-minute basis, and I think it has much more, it resonates much more for the listener when they hear how important the services they're receiving or the services they need or could be receiving would have an impact. And I think if that's something of interest of yours, we would love to talk a little further about that. If you would like to sign up, we can certainly, touch base with you about that to get you involved with that if that's something you would like to do. So, lastly, the things that I talked about at the very beginning related to the federal type stuff and the state government stuff, Director John Martin, who is our State Department of DD Director, is coming down a week from today from 8:30 to 12:30 with some of his staff to actually spend, it's a 4-hour meeting, so it's a little bit of a chunk out of your day, but they're going to spend all that time talking about just some of the things I briefly touched on at the beginning and some of the things that are coming down the pipe related to some of the budget type stuff, things of that sort. If you didn't already do so, there's an information sheet over there that you can pick up, and actually they would like if you could sign up for that. It's going to be in Mason, and I don't have, but it's I think Christ Church. Yeah, Crossroads Church. Next Tuesday, I would highly encourage if you can make time in your schedule, please make time to get to that, because there will be a lot of good information that I think you'll hear if you can make time to put that in your schedule and get more information on that. So I think that's what I got. So I do have time for some questions. If you guys have questions, things that I touched on that you...
Regarding the levies, you're aware. Do you have anyone in the cast numbers, percentage of people being served, percentage of people don't have services neither for Polk County?
So the question is, for the levy that we'll be looking at next year, do we have numbers of people served and numbers of people that waiting? Yes, we have those numbers. So we have roughly, it's a little hard to track in terms of total numbers served because it's fairly fluid. It can be fluid, some people are in and out, that kind of thing. I think when we look at it, we're serving about 1,200 individuals at any given time here in Claremont County. And that could be from or it might just be touching base with them every once in a while, but it could be, and then our waiting list numbers, some of those I've projected on the screen a little bit in terms of what we're looking at there, but we do have waiting list numbers for each and every one of the
So
services.
you're looking at approximately 1,200 in the counties that are getting services now.
Roughly, yes.
Minimum to whatever the maximum is.
Right.
Beyond that, how many more do you have that need services that we can't provide for because of the limitations on funds?
Yeah, so the question is how many more above and beyond that 1,200 are we talking about? And that's a way
Are we at 1,200? I mean, are we doubling the number? Is that what we're looking at?
well, I think it's a little tricky because you don't want to lose sight of the fact that some of our waiting list numbers account for the fact that they may be getting something, but maybe ultimately not what they ultimately need. So I think that's
What I'm trying to get at is, okay, what percentage of the county are we serving or could we serve with more money available?
sure, and that's the information that we have to put together to make sure that that's the message.
So how would it, a few years ago, with the letter.
Yeah.
I don't know whether help or not passed.
Right.
It can't hurt anything to throw some numbers out and say, hey, look, we've got this many people that don't get services because we're limited in funds.
Right.
Help us.
Right.
You can't look down at people that are disabled and say, we can't help you. Somebody's got to help.
Right, and we do have, I mean, we can absolutely, I don't have his right hand with that, we can absolutely produce that, especially when we get into services like, things like individual budget waiver, those kinds of things, where people they're really getting nothing, they could absolutely use, and it's a big number. And
The whole money situation would go to your last line about the providers and training. I mean, I'm going to live forever. Whether my daughter lives beyond my time or not, somebody's got to take care of it. That's in my will for my son to take care of. Beyond that, there's other people that don't have that option.
Right, absolutely.
Either somebody here is going to have to take care of them, or somebody outside is
Right.
going to take care of them. And if you don't have providers,
And those are the things we want to be planful about. We can certainly address emergencies, but if that's a number that all of a sudden just leaps at us, I mean, that's
about 4 years down the road, you're going to be running into red.
oh, we can't let that happen.
There's
Yeah,
got to be something happen between now and then, and the levy would be a good starting point.
it's
Whether
the
that
start.
takes us the project for another 10 years or not, who knows?
Right, those are the things that we need to do.
And is this a new levy or a replacement of an existing?
So the question is this a new levy or a replacement of an existing one? It is the replacement of an existing, it's actually replacing, when we consider replacing 2 of our continuing levies. So what that means is when we talk about replacement, because this gets a little confusing. So when we talk about replacement means we're asking the voter to replace it to the value of their home today. So again, if it was, using that value example, if it was $100,000 back in 1980, and now it's worth $150,000, the additional, when you vote to say yes, you're saying I'm going to pay that additional property amount for that $50,000. And then what that ultimately does is provides more revenue for us to be able to continue our mission.
So in other words, if I understand, all new development that is happening in Marion County, is that included in our existing levy today, or would that be all new monies to come?
Sorry, the question is new development. Anytime there is a new house built, it comes, we get revenue for that. So that doesn't replace, but it's only
At the total value of the new home.
at the total value of your home, but only at the effective rate that's there now. So what happens is with the replacement, you bring it up to the voted millage.
So valuation and a millage percentage that we're looking at. Is that correct? Or
No, it's just simply, what it is just bringing those back up to their voted millage. Yeah.
What is happening between you and the providers that exist and/or providers who we, how you make a process that's changed?
So the question is, how do the providers that exist or that we're looking to recruit and our agency communicate related to some of the changes that are coming? We do have provider meetings monthly that providers are invited to that we try and make sure that we're touching base with. I have visited a couple of providers just to keep close contact. A lot of the providers kind of have their own almost trade association that they kind of hear about things that are happening as well. But I haven't, to be honest, I haven't done a lot yet for the sake of looking at the changes because we're still waiting to get kind of final word on what exactly that's going to look like. But when that happens, we're going to be meeting very diligent because we have to get moving on what that's going to look like related to some of the changes. And it'll look a little different for each provider. Some providers are, they're right there. They don't have to do a whole lot. Some providers may have to do quite a bit to come into alignment with what the rule requires. So.
They have, agency that they get,
Do the providers have?
they've gotten all of this and other information.
Yeah, typically, a lot of our providers, like I mentioned, have a trade association called Opera. I don't know exactly that. They typically get a lot of information from that. But a lot of providers keep a close eye. I try and communicate through the beacon that I send out, and they get just information that's happening, things of that sort, and then through the provider meetings, things.
What has, if anything, has happened, licensure? I know this first came out, said that licenses will not be renewed. Providers and there will be another level.
The question is related to licensure. There aren't any new licenses, but in terms of the licensed facilities that exist today, there are some rules that are constantly being looked at related to licensure. It's not going away, but it's in terms of things like one of the big ones that's out there is the number of individuals that can live in a one bedroom in a licensed facility. It had always been permitted that you could have 3, but there's a big emphasis on no more than 2 moving forward. And so the licensure rules that's not going away, but they're always looking at the rules related to tweaking and making sure that they're, in the best interest of the people that are being served in those facilities. So.
There's a group of advocacy group called Arc of Ohio that I get emails from probably 3 times a week.
Yeah.
That's where I found out about these providers. I don't know if everybody gets that or not.
Yeah, the Arc of Ohio.
Information.
Yeah, they send out email blasts about information too. So.
What is the beginning for?
ARC Ohio.
Is there going to be any change to Ohio waiver?
Any change to Iowa waiver? The only change which is actually interesting, is nursing. It looks like nursing will be an added service into the Iowa waiver, which is a pretty big change and a pretty big deal. So, yeah, for individuals in their homes. So that's something that we're anticipating. So, is that right, Sharon? Yep, thank you, Sharon. These are things that get a little outside of it, but yes, that's my understanding. That's probably the biggest change that we're seeing maybe coming down the pike of Bio. So I'll make sure I'm catching people with them.
So if right now, my child's on a TD waiver and that goes away, and he has nursing care now, he can still have nursing care with his children tonight waiver, because that will be added to it.
Well, it's going to be dependent a little bit on kind of if those needs can be met through like a delegated nurse or some other. I think there's going to be an assessment to try and really figure out, okay, well, what is that a need that is still going to be necessary under the Iowa waiver, or is it something that can be looked at in terms of delegated nursing? But yes, they will.
Delegated nurse.
A delegated nurse is someone who is trained under there's an RN that trains a staff person to be able to do things like administer medication under that nurse's license.
They
So
wouldn't be a nurse, they would just be a medical somebody.
they could be the staff person that is delegated under that. But if it's still a need, it will still be in that person's plan. So if it's still something that they absolutely need that nursing, then it will still be there and paid for through the Iowa waiver. that's one of the big reasons as to why it was added to the Iowa waiver going forward. I'll come back.
It's a little bit personal issue. I want to vote, and I kind of just want to put it out there and see if everybody else is having the situation. I have a nurse that's been with us for 6 years. He is an independent. He is an LPN. He has just been advised of a 4th cut in 6 years to his salary. Never has he had an increase. He's always had a decrease in his salary. Now he's still there. Amazing, absolutely amazing. But is that part, this cutting of these LPNs, independents, is that part of the, we got the explanation that it's part of the modernization situation. And I will be at a meeting next Tuesday out here again. But
And probably get a better answer for that.
I'm kind of putting it out there here to say, is anybody else seeing this, or is it just, I can't imagine it's just us, but he's had 4 cuts in his salary. This one happens to people about a little over $400 a month. That's an awfully big cut for a person who's been dedicated for 6 years to the same family, done a marvelous job. I've got doctors that recommend me on a regular basis, and I don't understand. So it's out there. I've been sitting here wanting to say,
What kind of impact? I think the whole impact that everybody around the table has is the state, everybody was basically running out of money. We passed back this, the entrance to the state of Ohio, we added over 250,000 people to Medicaid. It's got to have an impact on your, especially you.
I mean, in terms of the,
Yeah, we got that.
Medicaid, yeah.
And the federal government doesn't have the money to pay the state for their increase in hospitalization. It all runs down the other.
Yeah.
the situation that we've got, I'm sorry.
It's gotta be a
that I
right
didn't
to try to
throw.
work out and try to work with those guys and stay.
We've been advised that the registered nurses got an increase and the assistants got an increase. The only ones that got cut were the LPNs.
And I'm just not familiar with
I'm
that
not
enough to
either,
be
but
able to,
I'm
and that's probably a good question for next
Just
Tuesday.
like I said,
Yeah.
just put it out there.
No, it's just budgets in general, guys.
Budgets in general. so-
Yeah, the insurance issue.
Hey, 15 years ago, your contractor was building 300 homes a year, just one contract. Now it goes to
Yeah.
But it's just, and we've added and added and added. And I think we got
I sure hope not. Yeah.
It's really going to get very, very good.
It is challenging, there is no doubt. Yes. So, yeah, so the question is that, you mentioned is it your neighbor you mentioned?
Yes.
Okay, a neighbor who is elderly has her son living with her who has a level 1 waiver. And if we freeze waiting lists, what does that mean for potential services for him down the road, or maybe getting an IO waiver, things of that sort? The good news for him is he's on a waiver. And what happens is, in those situations, we have to evaluate the person's need. And so if it's a situation that there's some drastic change in the need, either of the family, heaven forbid something would happen to mom, and at that point, what our SSAs do is evaluate that and say, this person's needs have changed, and so this level 1, based on it's an emergency, doesn't cut it anymore. He's going to need something that's going to be more robust to be able to provide for his needs. And so what happens is then we request that be moved to an IO waiver potentially, or something that might better meet his needs. Right. meeting at that point. And I think one of the things that I think is important to play, as I look at that, I have to think, we also want to encourage other resources, other natural support, other things that potentially can be put in place to maybe replace some of those things that may be lost through this change, but ultimately boost that. So those are things, as those teams get together, they need to be talking about and thinking about, because sometimes it was something that we just got into the team, but we never thought about this resource might be available, or this person out there, or something like that that can help in the situation. So that's important, I think, to share as well. Well, it's really just an SSA. The question was, what's the difference between a case manager and an SSA? They're one of the same people, so we just sometimes use it because it's a little easier than SSA language. But our SSAs, our service and support administrators, sometimes they get referred to as the old term case manager, but they're the same. There's no difference.
Services be transferred or added to the IO, because most of them are being community integration, but yet I realize the IO is basically.
Right.
Will there be a transition there, or is there something else we need to plan for that?
I think that's not a quick, there won't be a quick transition with that, but I do anticipate that we will see more of an emphasis on trying to use some of those services more towards the support, because the emphasis is on community integration much more and more. That's not going to be like an immediate thing, but it's certainly something I would anticipate that we will see some change with, because it's something that is where everything is headed. So yeah. Yeah, if those things don't match up, then you're talking on both sides of your mouth. So. Any other questions?
Chris has one.
Oh, I'm sorry. Oh, sorry, Chris.
Based on your life, what is your forecast for the number of people transitioning out of the safety of school funding into, I guess, the abyss of not having funding coming up the next couple of years?
The question is, what is our forecast in relation to the number of kids transitioning out of the school into our adult services world? And I have to be fairly transparent. I don't think I don't really have great figures on that. That is something I think we need to explore indulgently. What I can tell you is we don't have a huge waiting list for our adult services program, which somewhat surprises me. I do think we see quite a few schools and students that are very concentrated on work, and they're doing a lot around trying to get these kids prepared for the work world. But for those with the most significant needs, we got to get some better data. I'm going to be very honest with you. I don't have that, but that's something that has been on my mind. So. Yeah, so the point I made up is the folks coming out of developmental centers they do have very significant needs. We are able to, in a lot of instances, typically when an individual's coming out of the developmental center, there's been such an emphasis on providing funding for that effort that it also provides for day services as well. The biggest key will be finding day service providers that can meet that need in terms of some of the needs that come out of, for folks that come out of developmental centers. And that's another thing we have to, and we have some partners in the room that do that. Yeah.
Approximately for each SSA right now, it's handling families and individuals on waivers. How many of those do each of them handle?
So caseload sizes for SSAs, we try and strive for about 35, no more than 35, is that right, Sharon? Am I right on that number? Thank you, sorry, I have to go back to my end. Yeah, so it's about 35, but we try and not exceed that number for caseloads of our SSAs based on the thank you guys so much. This means a lot that you took the time to come out today. So please sign up if you're interested. For right now, so the question was, are they going to let the independent providers alone and let them continue? For right now, that's my understanding, yes, that was removed from the budget. Now, I don't know what the future holds with that. I don't know if there's going to be an effort to try and to do that again, but at least right now, it's not something that's going on. So there's no timeline on it, right? So that was, I think, a few things where there were some questions about that in the audience, so I understood that. Yes. So the question is, if the child's on an IO waiver, is his eligibility affected by the parents? I'm getting those. I'm going to make sure I no. So, yeah, that's not considered. It's only, it is that individual's eligibility for Medicaid not considered based on the family's income. That is correct. Right? I have to look at my cohorts just to make sure I'm answering you correctly. Because I don't know, but yes, that is correct. So in the situation with the individual, they'd have to, if they have assets that exceed the Medicaid, eligibility, then there would have to be something done about that to make sure that that's taken care of.
I'm not knowledgeable about all that on this stuff. Medicaid sometimes affected by household income tax. Like kind of labor. You're saying that's not the same as regular Medicaid.
If it's a child and they're under 18 and you're just applying for straight Medicaid, leave the waiver out of it. It is based on your household income. If the individual state comes up and receives any of the three waivers, the level 1, the self, or the IO, that's the point of the waiving. It waives families' income to allow them to get Medicaid to get on the waiver. So, but anything over the age of 18, they can still live in the family's household with or without a waiver, and it's based on the individual, because at that point, they're their own guardian. It becomes about their assets, not the household assets.
We have a situation that's not my waiver.
Okay, so that waiver is what waived your income to allow them to get Medicaid. If you would have just went and applied for straight Medicaid without the waiver, it would have been based on your income. And if you have dual income, more likely you probably would not have qualified for just straight Medicaid.
I'm sure that was the game.
I have
Yeah.
a question. When you talk about the double limit and the provides service,
Oh,
my brother had to go to work typical.
Okay.
Providing him transportation, plus they also provide some services for work here. Can they not do both of those?
they can. So this only, they can. Yeah. So if the question was, your brother goes to Goodwill, which is a day service provider in our county, they use the waiver for the funding for that. And they provide the transportation, they provide the services while he's there. And the question was, is this conflict of interest thing going to impact Goodwill? No, because they don't provide the case management function. So we provide the case, like at the county board, what ends up happening when your brother goes to Goodwill, there's a case manager, there's a worker here that's putting a plan together about what those services are going to be and that kind of thing, and they're working with Goodwill on that along. And so
Just make sure that's.
yeah, so that's a clear picture of that, where CMS likes that nice clean line. So you've got the case manager over here doing that, and you got a private provider providing a service, and you don't have to do them both.
So that would probably be like the same
board meeting where I have a brother who lives at home. And then he's on the waiver program where they pick him up and take him to the Bethel hands-on-hands program. So I think that's an individual program.
Yeah, I'm not familiar with it, but I'm sure it's a way.
They're the ones that pick them up, and from home, take him wherever they go, programs and stuff that they do, and then they bring him back home. So, and that's the only thing that we actually get. I mean, we don't use any of the other services on that, so.
Yeah. The thing that I just want to make sure, I don't want to get too far in the weeds with this, but the private providers like the Goodwills and they'll still need to abide eventually by that integration kind of mandate that's coming on the CMS side. Now, yeah, I know that's probably where we're going to go. Right. So there is still that Goodwills and all the providers that are in our community that provide day services will still have to abide by that rule. And we're going to work, here's the deal, we're going to work very closely at the county board level with those providers to really work on what does that look like. Because we don't have the clearest of pictures yet. I mean, I've been on some committees and things like that, and I have a little bit of an idea, but it's going to take some time because you just don't flip these switches and everything just, you do that the next day. It's going to take some time. But they're going to have to abide by that. But this conflict of interest thing does not come into play for these providers. So is that kind of the question? Yeah. Right. They will have to, those, and the thing that I know with Goodwill and some of the other providers, they are understanding that, but it's not just, again, something you flip the switch and that happens overnight. So, and as I mentioned, I'm anticipating, I don't want to say it's a done deal because it would be irresponsible of me to do that, but I'm anticipating that for those types of services we're talking about, I'm really anticipating it's going to be that 9-year, 10-year, that's what I anticipate. Now, there's nothing, so don't go out of here and say Dan said this, but I'm anticipating that's where things might be headed with that. We just haven't heard that officially yet. So that gives us a little bit more time to work it out. Right. See any other hands? Yeah. Traditionally, the hours for the programs are usually the dedication of at least about 6 hours a day. And that's historically kind of been the case. And that's pretty traditional for most of the programs that operate for day services. Now, why that is, I think that's just, again, the additional, and typically when you're adding in transportation on both ends of that, it can, you know, it can expand. But yeah, I can see how that would certainly impact to the point where you need it.
Right.
Yeah.
And, you know, it's just something that's, you know, I just figured this out, and talk about, social programming, work setting, and I understand all that.
Sure.
I'm not against, particularly for making it work, well, because we got issues. But, when you can't, you get work, and I'm going to help people out, I can not work.
Sure.
And I, you know, I'm a professional who make very good money. So I didn't talk to people, and one of the things I was told is a lot of people that are parents or loved ones aren't working outside the home, and with how they do that, or, you know, yeah. So, but before that, you know, I mean, if you have someone who cares, yeah, and you pay so
Yeah, well, I know, and that comes into play, I know, and that's hard, but I mean, those are a lot of the ways that kind of happens, is the options that are available kind of thing. I know one of the things that certainly is being looked at when we talk about the day services into the future is, especially when we look at employment too, recognizing that many individuals that may get a job may not have a job that's 40 hours a week, so we're going to need some wraparound supports, you know, to be able to figure that out, because it's just like you're referring to, you know, if it's just 20 hours a week, then that's, you know, what does the rest of that 20 hours look like? And so that's something that's being talked about as well, because there's got to be something on the backside of that job to be able, if the person can't be independent and, you know, and be on their own, then there's got to be some services in place to be able to make it a worthwhile venture for them to even venture out and get that 20-hour-a-week job. So those are things that we have to think about as we head into the future, because nobody's going to do it. They're not going to, because it just doesn't need it. So. Yeah. Right. Yeah, and those are things that, I mean, you know, and I don't want to speak specifically, but those are things we have to think about, because it's going to be, it is a struggle for sure. Yeah. Right, right. Yeah, for sure. Yeah, we have to explore that. We may explore what we want.
I'm trying to.
No, absolutely.
Being part of solutions.
I appreciate that.
Do that. And I really believe that because I have financial issues and that's not really fair, because I can see that and there's because I'm taking care of the rest of want to, and I love to, you know, but my retirement,
Sure.
yeah, my retirement, as it ends, now plans for something happens to me, and he's going to take care of it.
Yeah, and those are all things that many folks will face on that should be done. So.
And I have a client that is on both the Iowa waiver and the individual. Now, will he have to decide which one?
Yes.
Okay, and it will be January, but he'll be able to figure it out. But we have to make that in January, is that what it is?
Yes.
Okay. And I have another individual who is on the individual budget, but he gets funding, he gets
so much per year. Will that stop? Will the funding stop? But will
Even the individual budget funding is remaining the same.
the same, okay,
Yeah.
so it will be the same,
Yes.
even though,
If he's got it now and he doesn't have another dual funding stream, then it'll just be like
he'll be able
it
to
always
get that,
is.
and that small amount of money that he gets every year, that the cash that he gets to go and do different things, he'll still be able to get that.
I would anticipate, yes. Not
We're
knowing.
looking at those.
No.
And there's going to be some modifications to the procedures on that. But
Okay.
he'll be assigned a new SSA because we've split into teams. And letters were sent out to the individuals and they'll be discussing that with them at their planning, at their pre-planning meetings.
Okay.
Okay. Yes. No.
Certain amount of action, like, certain amount of process. Are we gonna have those here or is that years?
Yeah, and you're talking about our ancillary, alternative options. I always want to call it ancillary, I don't know. The alternative options, yeah. So we've had a funding stream that local dollars that we use for things such as, to meet needs of families, like things such as camp, things of that sort that you can apply for each year. That's a decision we have to make going into every year. So our board, as we get into the planning, always will be looking at that to decide if that's something we continue into 2016 or we make some different decisions. It was continued this year, it was on a reduced, so it was a reduced number this year. So I can't anticipate what that's going to look like. My hope is we'll continue to do that because I think it's meeting a lot of needs and it's certainly something that is a good thing. But that's again, it's a board decision that we have to look at that as we get into planning. And the thing I want to mention to you that I think is important is that when we actually have a public opportunity for the public to offer input for our planning every year. So I always want to make reference to the fact that if there's something, and we will put out our draft annual plan that will speak to things like alternative options funds, things like that, and we advertise to get public input on that at a session. And if you can't make a session, we can take it via email or things like that. So those are things to keep an eye out for as we head down that road. Anything else? Yeah. Oh, yeah, I'm sorry. Sorry about that. I always enjoy seeing you guys, it's always great. So it's great to see you again tonight. Well, if there aren't any more questions, I really, truly want to thank you so much for coming out tonight.